we have restroom support. The scenario is a Chinese kindergarten male student who is not potty trained. The parent requests that the mother requests that he be changed every 2 hours. So there's some considerations to think about too: cultural sensitivity, student needs, school policies, staff responsibilities, and legal guidelines. We'll start with legal and policy considerations. So we need to think about IDEA and Section 504 to determine if there is a medical or developmental reason for the lack of potty training. If so, evaluate for potential special education or 504 accommodations. The school district policy also needs to be considered. Review district policies on diapering and toileting in kindergarten. Additionally, health and safety regulations ensure compliance with sanitation and welfare guidelines. Also consider board policy. Local districts may not publicly specify a policy regarding kindergarten students who are not potty trained. However, local school districts are committed to providing a safe and inclusive learning environment for all students, as outlined in Board Policy 0410, which prohibits discrimination based on various characteristics, including disability and parental status. Additionally, begin to think about cultural sensitivity. So understand cultural expectations. Some cultures delay potty training due to family traditions or different developmental expectations. Additionally, build trust with families. Engage in open communication with the mother to understand her perspective and explain school expectations. Remember to offer support rather than judgment. Think about staffing and resources. Who's responsible? Teacher and instructional aides may not be required to change students. School nurses or health aides may have specific protocols. Special education staff might assist if the child has an IEP. Paraprofessional aid or support. If necessary, consider assigning an aide or requesting additional staff support. The school's role and solutions. Begin with parent collaboration, meet with the mother, create a transition plan for potty training, provide resources or recommendations, recommend professional support if needed, have a gradual independence plan, implement bathroom routines with positive reinforcements, use visual schedules, timers, and encouragement to promote self-care skills. There's also alternative accommodations. Encourage the use of pull-ups instead of diapers. Provide a designated restroom or space for changing if needed. Address staffing concerns. So think about workload and fairness. Ensure that extra care responsibilities do not disrupt instruction. There is also professional boundaries to consider. Clarify staff roles and provide training if necessary. Additionally, think about sanitation and safety. So we want to make sure maintaining a proper hygiene protocols for diapering and changing our accidents. The next step in an action plan. First step is meet with a parent to discuss concerns and expectations. Step 2, review the district's policies on toileting in kindergarten. Step 3, determine if additional assessments are needed for special education services. Step 4, develop a gradual potty training plan with the teacher and family collaboration. Step 5, monitor progress and adjust support as needed. Conclusion. Approach the situation with empathy, collaboration, and adherence to policy. Ensure that the student receives appropriate support while maintaining fairness to staff and peers.